I think every San Diegan would acknowledge that the problem is not visibly getting better. And as a consequence, we have to try different approaches, and this is what we're doing.
San Diego Mayor Todd Gloria and County of San Diego officials are working to open new kinds of homeless shelters, ones that aim to help those with severe substance addictions.
This is not a time to tell people who are willing to raise their hand and accept services that they can't come in here. And if that means bringing someone in who is heavily intoxicated or in other kinds of active conditions that typically or historically have been barriers to admitting them into the service, what the county and the city are now saying is, no, we want to work with you.
The new harm reduction shelters follow a month-long homeless outreach push in the downtown area. San Diego already has several bridge shelters where 100 or more people are staying in group settings. But these new shelters, called Safe Havens, are designed to be smaller, housing 25 to 50 people in individual rooms.
To really bring online a new capacity that doesn't currently exist.
County Supervisor Nathan Fletcher is partnering with Gloria to make this a reality. He says right now many shelters won't let those in who aren't sober or committed to being sober, but he says that drug use will not be allowed inside these new shelters.
People aren't going to break the law in a government-funded location, but it's about having an open-door policy that says come as you are. In whatever state of mind you're in, we welcome you in, and we're gonna infuse that location with services.
Fletcher says people may be staying there for a significant period of time.
But I don't know that someone who's been on the streets for a decade, who has chronic severe alcoholism and drug addiction, it's going to take some time. And that's why we did an initial 5-year investment in this project. We've got to make that investment. We've got to make a sustained investment.
The county has committed to supplying specialized outreach teams, and it will split shelter operating costs with the city.
We want multiple locations, but look, this is very challenging. I mean, everyone wants you to solve homelessness as long as you don't do it anywhere near them. And so this is, it's difficult to identify locations, to find locations, to be able to get them going.
City officials have been tasked with finding locations for the new shelters. Nothing has been announced yet, but Gloria says community buy-in is key for their success.
I promise you that we can accommodate this into a community in a way that actually improves the neighborhood, reduces the number of unsheltered in the surrounding area. I believe that we can do this in a way that actually uplifts the neighborhood, doesn't harm it.
Gloria says these harm reduction model shelters have been the missing ingredient for success here.
We know that when we do that, it is far more likely that we can break that cycle of addiction, address the underlying mental health concerns, and ultimately get this person stably housed and off the streets for good. That's a part of the notion behind when I say I want to end chronic homelessness. This is how you do it.
The city is using American Rescue Plan funding for the Safe Haven shelters. Then Gloria wants to approach the city council to fund them long term.
It's a gap in our system and a part of why we are not seeing the change that we want to see in every one of our neighborhoods, a part of why we're spending more than we ever have, but we're not getting the results that we want. We want different results, so we're choosing to employ different tools, and I think we'll be proven successful.
He says the pilot shelter program is designed to get people who are chronically homeless off the streets, a goal that's also shared by Fletcher.
We know that if we bring you in and we make that initial help to say, hey, we care about you, we want to get you some help, that will lead to the outcomes that we think are best. But it's a very different approach and path.
The city and county want to open the shelters as quickly as possible, but right now the timeline is fluid. Gloria says it's important to get them right the first time.
It could be a city-owned facility staffed by county workers, and that could be it. It could be a privately owned facility with city and county teams with nonprofit partners as well. So we're open on that suggestion because at this point in time, we need to get this up and running. We need to start getting folks served in these safe havens.
Matt Hoffman, KPBS News.